Come on. Okay, give me a second. The politics of higher education. When we're talking about college education, there are a number of issues that all seem to stem from financial issues. If you think back to some of the things we've discussed, the major one regarding college funding was in the early 2000s. The state legislature was facing a budget crisis. So what they did was they decided they would quit funding higher education. They would lower the level of funding for colleges. To make up this funding that the colleges were losing, the state legislature told the colleges, we are going to deregulate tuition. Before then, when the state was funding tuition at a high level, or colleges at a high level, the colleges were very limited in how much they could raise tuition. The state said, we're going to cut our funding to you. In return, you can raise your tuition to make up the shortfall. And since around 2003, the colleges have gone nuts with tuition. The issue we have, this financial issue, is we are starting to price out the middle class and the lower class. It is not feasible or affordable to go to college anymore. So financial issues are making it more difficult for students to attend college. Faculty issues. Colleges don't have much money. It is difficult to retain, and pay good faculty. Colleges do have a number of bills. They have a number of things they have to pay. So we see that faculty pay is suffering. So we're seeing a number of faculty that they're leaving the college ranks and they're going to the private sector. This makes retention very difficult if you cannot compete for a pay grade. And at the end of the day, no matter how much you love your job, you have to survive. So the money issues make retention difficult, even for faculty. It's hard to keep them. One of the things that is stated that a good college needs, part of a good college education, is diversity. This is being, what word do I want? Starts with an E, I think. Drawing a blank. Exposed. Thank you. This is being exposed to new ideas, new people, new races, ethnicities, religions, whatever. With the financial issues, it is hard for the poor, the working poor, middle class. It's hard for minorities to attend college. We are not seeing the diversity that we need to, or that we're told we need to have, to ensure a good all-around education. However, even with all of these issues, you can still get a quality education at Texas. Texas has 2 colleges that rank in the top 50 in the United States. These 2 colleges are going to be University of Texas and Texas A&M. Let's move into Health and Human Services. Now, Health and Human Services was the second most costly category of state spending. The Health and Human Services is going to encompass public assistance, Medicaid for the poor, and a variety of other programs. If you recall, in the 2010-2011 budget, These programs cost $59.7 billion, or 32.8% of the state's total budget. However, 60 billion sounds like a lot, but 60% of this 60 billion originates as grant and aids from the federal government. So while we say the state is kicking in 60 billion, 36 billion is coming from the federal government. So in our reality, we're only kicking in 24 billion of our money. Under the Health and Human Services Department, we have the Texas Department of Health Services, DHS. DHS provides a variety of health services for special populations. They run the county hospitals and county clinics that provide care to the indigent and the uninsured. Problem is, many of these use this county hospital as their primary care. They will go and use the emergency rooms as primary care. This raises the cost and makes things more expensive. Socialized medicine. Texas spends more than 1/5 of its state budget on the Medicaid program. Once again, 60% of Medicaid costs originate as federal funding. Socialized medicine, the government's going to pay for it, provided something like that. However, when we're talking about Medicaid, we have to realize that more than 90% of Medicaid patients are elderly, disabled, or children. We have a program called the Children's Health Insurance Program, CHIP, C-H-I-P, which helps insure children of parents who have an income less than 200% of the poverty level have insurance. Despite the programs that we have, despite Medicaid, despite CHIP, 1 in 5 Texas children is uninsured. Let's see what else. Insurance, since we're talking about insurance. 51% of Texans have health insurance through employer-sponsored plans, and another 5% have private individual policies. The state will pay private insurance companies part of the premiums for its employees and the teachers. However, high costs of insurance have caused many employers to drop health insurance benefits, with the result that Texas leads the nation in the percentage of people without health insurance. So we are number 1 in the percent of people who do not have health coverage. Congress passed health care reform in 2010 in an attempt to provide universal health care access. This is the Affordable Care Act, also known as Obamacare. With Obamacare, with the Affordable Care Act, health insurance companies will no longer be able to drop beneficiaries when they get sick, and people cannot be refused insurance because of pre-existing conditions. Pre-existing conditions is if you have cancer, some disease, diabetes, something, if you have an illness or a condition, you can now change jobs, you can now change insurance companies. They have to take you as a new client, they have to cover your existing condition. Thanks to Obamacare, the Affordable Care Act, everyone's going to be required to have health insurance, or else they will have to pay a fine to the federal government. Because Texas has the largest percentage of uninsured in the nation, how they take these health cares, what more they do with them, this health care reform will have a dramatic impact on Texans. If we're talking about state health care, and this is kind of what I'm getting at, state is the direct provider of the health care. This means that the state's going to run the hospital. The state's going to run the clinic, the county hospital, the county clinics. That's where the state is the direct provider. Second type, state is the payer, but not provider. This is for the employees. This means that the state is paying for the insurance premiums, is paying for the health insurance for the state employees, for the people who work for it. The state is the regulator and the buyer of private insurance. So they're going to dictate what is going to be included in the purchase price or in the policy, and the state is going to purchase it for the individual. Examples of that would be Medicare. It would be Medicaid. It would be the Children's Health Insurance Program. It would be CHIP. Other things that we need to talk about: unemployment insurance and TANF. Let's start off with unemployment insurance, since it's at the top of the slide. Unemployment insurance is funded by a tax on employers and is administered by the Texas Workforce Commission. Eligibility for unemployment insurance is limited to unemployment due to layoffs. Now, 99.9% of the time, this is the cause. If you get laid off from your job due to no fault of your own, work slows down, the company goes out of business, whatnot, you are eligible to claim unemployment. You cannot get mad, quit your job, and claim unemployment. Now, here's that 0.1%. Every once in a while, very, very occasionally, you can quit your job and you can attempt to claim unemployment. If you can go prove to the Workforce Commission that you had to quit your job was so miserable, maybe physical conditions, mental conditions, there was something wrong, you quit for your health, for whatever reason, 1 in 1,000 claims like this will get approved for unemployment. But for the most part, the only time you're eligible for unemployment insurance is when you're laid off. Maximum benefits, it varies from state to state. It varies, and I say this because the federal government, they will try and pass programs that will increase the length of unemployment. It has varied from anywhere from 26 weeks, half a year, 6 months, up to 52 weeks, up to a year. We see that only 25% of unemployed Texas workers qualify for unemployment benefits. So for whatever reason, only 25% of the people who are unemployed in Texas qualify for unemployment. TANF, T-A-N-F, stands for Temporary Assistance to Needy Families. This program is designed for children whose parents are incapable of providing for the children's most basic needs. If we're talking about TANF, there are some very, very strict requirements, or there's restrictions, very strict restrictions on it. Adults can only receive TANF for 2 consecutive years, and they can only receive TANF for a total of 5 years in their lifetime. So what this means is that they could receive TANF for 2 years to help their child. They would have to take off a year. They could receive TANF benefits for another 2 years, so there's 4 years, take off a year, and then they can receive TANF benefits 1 more year for 5 years. Once they hit that 5th year, that's it. They are no longer eligible ever. Now, TANF, it's not much. Like it's paying. It's for the children whose parents cannot meet their basic needs. They cannot purchase their basic necessities for them. But in 2010, 2011, that fiscal year, the maximum monthly TANF grant for a family of 3. So mother, father, child, single parent, 2 kids, the maximum amount of money they can get per month was $260. This is considerably lower than the national average. Texas median TANF grant is about half the national median. So the national pays about $520, Texas pays about $260. And TANF accounts for 0.1%. 0.1, I will rephrase that, percent of the Texas budget. I mean, $260 for a family of 3, for a mother, father, and a child, or a mother and 2 children, or a father and 2 children. And what can you buy for $260 a month? If you have a child that's 1 year old and you need diapers and baby food, will that even begin to cover the child's basic needs? The politics of welfare, myths and realities. We have a lot of people get upset that people are on welfare, these entitlement programs. There's this erroneous belief that any poor person may be eligible for welfare. This is not true. There are a number of restrictions. There's a lot of paperwork to fill out. Even if you look at unemployment, how I told you 1 out of 4, 25% of Texans are eligible for unemployment. That is not any poor person. That is very, very little. Another issue we have is that public assistance programs alleviate rather than cure. And what this means is that we are providing these entitlement programs, these public assistance programs, are providing help, but it's a temporary fix. They are not teaching the individual, or they're not allowing the individual to stand up on their own 2 feet. We are going to help you, like TANF, we're going to help you for 2 years. Well, that's great, but if you don't take this, if you don't learn a job skill, or if you don't improve your lot in life in 2 years, where are you at for the next year? You're in the same boat financially. So we see that these public assistance programs alleviate. They provide a temporary assistance or temporary help, but they don't cure the problem. We're not going to get people off of these public assistance programs. We see a lot of resentment occur. A number of people say, I work hard for my money. Why are you taking my tax dollars to people who refuse to work? Well, this is going to go to that erroneous belief that any poor person may be eligible for welfare. It's difficult to determine cheating. This is true in anything. Are there people out there who scam the system? Yes, there are. I will be honest with you. Yes, there are. But they are really few and far between. Every once in a while you'll hear about an individual scamming the system, or you'll hear about a doctor's office that's defrauding Medicare or Medicaid. But really, it does not happen that often. The last thing I want to talk about are highway programs. Remember, this was the 3rd biggest expenditure, and not much, but it was the 3rd. The Texas Department of Transportation provides funding for primary and secondary roads. TxDOT is supervised by a 5-member commission. So, with me telling you this, you know that if it's by a commission, the commission is appointed by the governor with the consent of the Senate. These commission members serve a 6-year overlapping term. Oh, before you go here, stop, don't look, finish your notes. State monies account for about 60% of TxDOT funding. You know, when we were talking about social services or health and welfare, the federal government was kicking in 60%, the state was kicking in 40%. This is reversed. The state is responsible for 60% of TxDOT funding, and the federal government kicks in 40%. The state highway fund is supported through a sales tax on lubricants, motor vehicle registration fees, and the gas tax. Remember, I think we should have discussed that we have a 20-cent per gallon motor fuels tax. This 20-cent per gallon tax is included in the price of gasoline. So 75%, 3/4 of this 20% gas tax, 15 of the 20 cents, by law, has to go to TxDOT. So 15 cents out of every 20 of the gas tax has to go to the Department of Transportation. Do we need it? Well, if you look at the miles in Texas, the roadways in Texas, and this is from a couple of years ago, type of roadway, interstate highways. Texas has over 10,000 miles of interstate highway. This accommodates 27% of our traffic. FM roads, farm to market roads, almost 41,000, another 11%. Federal and state highways, 28,459. This accommodates approximately 36% of our traffic. But these total miles, we're looking at 51, 71, 70, 79, about 80,000 miles. However, look at the note underneath this. These figures do not include more than 225,349 miles of city streets and county roads, which accommodate approximately 1/4 of traffic. This means in the state of Texas, we have over 300,000 miles of roadway, which we need to take care of, which we need to maintain and keep it safe for the citizens of Texas or for other people passing through. That's a lot of asphalt. That's a lot of road. The politics of transportation. It's very, very hard for us to properly fund transportation. Roadways, it's hard for us to properly fund anything, let's be honest. Limited funding, we have the dedicated funds, the gas tax. Federal funds come with strings. Remember we talked about categorical grants and funding this way. So yes, we can get money from the federal government, but we're going to have to use it for certain purposes. It might not be the best use, or it might not be what we need now. With the privatization of highways, and we're seeing a lot more of this, this basically means toll roads. We are going to pay for the benefit of using a road. The advantage of this is it gets us through traffic, it moves us around quicker, it's safer. The disadvantage, we have to pay. Who is going to be able to do this? The upper middle class, the upper class, the working poor in Texas still aren't going to be able to afford this. While we're talking about the privatization of highways, at one point we actually saw a proposed Trans-Texas corridor. This was going to include superhighways, and this was going to have separate freight and commuter lanes. It's going to have railways. It's going to have high-speed commuter and freight lines. It's going to have utility corridors. You know, it's going to be for water, electricity, natural gas, petroleum, fiber optic telecommunications, broadband lines. However, this is Texas. You need land to have this super corridor. What we saw when this was brought to light, or when this idea was first floated, was there was a fear that property rights would be violated. Then we have the low tax conservatives, along with the nativists. Nativists are those who believe Texas needs to stay Texan, opposed to building the corridor. Nativists came into play because the group that was actually supposed to run the super corridor was going to be a group from Europe that was going to be the company in charge of it. And our attitude was, no, if we're going to have anybody in charge of this making money off of it, it's going to be somebody here in Texas. That's why the nativists got upset. Let's see, is there anything here that you don't know? We've talked about log rolling. That's the trading of votes. Dedicated funds. This means that by law, by statute, or by constitution, funds from this source must go to a particular area. The gasoline tax, the 20 cent per gallon tax. This is a dedicated fund. 15 of the 20 cents, 75%, must go to TxDOT. Discretionary funds. These are funds that can be used for anything. Everybody, every agency, every issue is competing for discretionary funds. Keep on telling you, money is a finite resource. Everybody is competing. The biannual legislative sessions. This actually makes spending hard because we have to provide a budget for 2 years. We have to predict how much money these agencies are going to need every 2 years to be successful. Finally, the last thing I want to talk about is mass transit. This would be Metro Rail in Houston. This would be the bus service. Texans, like most Americans, remain very unreceptive to mass transit as an alternative to individual motor vehicles. We see that only 4 to 6% of Texas residents regularly commute by urban mass transit. So, you've got to live in an urban area to have mass transit, and even if you do, only 4 to 6% use it. So while we may say mass transit's the answer, it'll take cars off the road, it'll make it easier to get around, we see very few people take advantage of this system.